Amyotrophic lateral sclerosis. An overview of ALS, or Lou Gehrig's disease.
Actually, I prefer Stephen Hawking's disease.
What is ALS, Professor Hawking?
ALS is a progressive neurodegenerative disease that affects nerve cells in the brain and spinal cord, leading to muscle weakness, atrophy, and paralysis.
The term amyotrophic refers to the muscle atrophy that results from the disorder, while lateral sclerosis indicates the areas in the spinal cord where nerve cells are located, and the scarring or hardening that occurs as the disease progresses. Arr. What be the signs and symptoms?
ALS usually begins with muscle weakness or stiffness and gradually progresses to affect voluntary muscle control.
Symptoms include difficulty speaking, swallowing, and eventually breathing.
Patients may experience muscle twitches, fasciculations, cramps, and changes in vocal pitch.
ALS often leads to emotional changes and cognitive impairment. In some cases. Key indicators.
Diagnosis of ALS is primarily based on the observation of both upper and lower motor neuron degeneration.
Oh no!
Specific signs include muscle weakness, atrophy, spasticity, and hyperreflexia.
So what do we do?
Diagnostic tests might include electromyography, MRI, and blood tests to exclude other conditions with similar symptoms.
Don't you give up on me!
Most vulnerable populations.
ALS can affect anyone, but is most commonly diagnosed in individuals aged 50 to 60.
Approximately 5 to 10% of cases are familial, where there is a genetic mutation linked to ALS.
Military veterans and people with a family history of the disease are at higher risk.
Men are slightly more likely to develop ALS than women.
PCP principles of management.
PCPs managing ALS patients ought to focus on symptom management and maintaining quality of life.
Do you have any suggestions?
Medications to manage symptoms such as muscle cramps, excessive salivation, and emotional lability. That is marvelous. Anything else? Therapies such as physical, occupational, and speech therapy to help maintain function and independence for as long as possible. Surely there's more that can be done, yes? Aye. Indeed. In the context of community paramedicine, nutritional support to address difficulties with swallowing and to prevent malnutrition.
Yummy, yummy, in my tummy.
All right, me mates. There'll be nothing more to see here, except perhaps this.
To infinity and beyond.